Hey guys, in this presentation we'll be discussing about prescribing medicines in telemedicine. How do you do that, and what are the instructions and what are the certain guidelines and rules which need to be followed? Well, we might ask, is this important? Is this? Why do you need to know this, right? It is very important to know these guidelines and rules because these will manage our profession, and these are very important to know before you enter a practice. So, prescribing medications via telemedicine consultation is at the professional discretion of the registered medical practitioner. It entails the same professional accountability as in the traditional in-person consult. So the same care needs to be given to the patient as you would give in a in-person inpatient consult. So if a medical condition requires a particular protocol, that means if a person has a certain disease, and to confirm that you need a certain protocol, and that protocol has to be followed before you approve any kind of medication to the patient. So you have to arrive at a diagnosis prior to providing medication to the patient. Without that, if you provide medication to the patient, if you prescribe it, it is a professional misconduct. The categories of medicines that can be prescribed via teleconsultation will be as notified in consultation with the central government from time to time. So it's better to keep ourselves updated with the latest information. They have listed the drugs into categories: list O, list A, list B, and prohibited list. When you're talking about list O, these are they're simply termed over-the-counter drugs. They comprise of those medicines which are safe to be prescribed through any mode of teleconsultation, like it may be video or audio or even chat. Uh, the examples are on your right side, and they would comprise of the medications which are used for common conditions, and they're often available over the counter. When you talk about list A, these are given during the first consultation or the follow-up for continuation of medications. The medications, those can be prescribed during the first consult and also for a refill in case of a follow-up. These have low abuse potential, and your examples can be seen on the right side of the screen. When you're talking about list B2, there's a small upgrade from list A, but it's a long list of examples there. And list B is a small little upgrade where you see the drugs only to be given during follow up, and an RMP can prescribe to a patient who is undergoing follow up consultation, in addition to those which have been prescribed during in person consult for the same medical condition. And now coming to the most important part, prohibited list. In this list, you can notice that RMP providing consultation should not provide these medicines in this list because they are listed in the Schedule X of Drug and Cosmetic Act and rules of any narcotic and psychotropic substance listed in the Narcotic Act. So that's it, guys. I hope this helps.